Welcome, folks. Today, we're diving into a fascinating case report on managing alcoholic liver disease with classical Ayurveda medicines. It's quite a detailed exploration of a 27-year-old male patient, his symptoms, and a long-term treatment plan.
Yeah, right. So we're talking about a patient with jaundice, loss of appetite, mild ascites, and even episodes of hematemesis, correct?
Exactly. The patient originally presented with yellow eyes and urine, generalized weakness, and abdominal pain. Notably, his condition worsened after initial allopathic treatments.
Mm-hmm. And instead of getting better with standard care, he turned to Ayurveda, which really changed the game.
Yes, yep. The report outlines that he was originally diagnosed with alcoholic liver disease along with signs of cirrhosis, and his liver functions were all over the place. Hyperbilirubinemia, elevated transaminases, and so forth.
Yeah. So they shifted his treatment approach entirely, using a range of classical Ayurvedic medications. What kinds of formulations did they use?
They started him off with Patola Katarohinyadi Kashaya, a decoction made from Guduchi, Nimba, Pumyamalaki, Bringaraja, Haridra, and Triphala, aimed at detoxification and removing the liver toxins.
Right. Interesting. And what about the tablets? I recall there were mentions of Arogyavardhini Vati, Kalmeg Ganvati, and Bhumyamalaki Ganvati as well.
Absolutely. Those were integral. Each tablet served a specific purpose. Arogyavardhini Vadi for promoting liver regeneration and metabolism, Kalmeg Ganvati to help with inflammation, and Bhumyamalaki Ganvati for its hepatoprotective properties. It's like they had a tailored approach targeting different aspects of liver injury.
Yeah. I'm curious though, was it just the medications or did they also emphasize lifestyle and dietary modifications?
Great point. Alongside these medicines, strict dietary advice played a crucial role. The patient was advised to avoid oily and spicy foods, non vegetarian items, and instead include bitter vegetables and green tender leaves to support
Right
his
on.
treatment.
So the treatment spanned over 6 months with regular follow-ups and lab tests, right?
Exactly. The timeline is quite detailed, starting with an initial exam in early April 2021, then subsequent visits where they monitored his bilirubin levels, liver enzymes, and even ultrasound changes. There were notable improvements in the color of his eyes, appetite, and overall liver function, while keeping adverse reactions minimal, except for that one challenging bout of hematemesis.
Mm-hmm. Speaking of that adverse reaction, isn't it kind of concerning that hematemesis occurred? How do you think that fits into the overall safety profile?
Well, it's a fair concern. The report acknowledged that incident, noting that it was managed with emergency care and blood transfusion. However, apart from that episode, there were no significant abnormalities detected in his liver or renal functions. So, the overall safety of the Ayurveda drugs, when used with strict dietary adherence and proper follow up, was supported by the case findings.
Yeah, I see. I'm intrigued by the Ayurvedic understanding presented. They mention concepts like dosha vitiation, kamala as jaundice, and the interplay of vata, pitta, and kapha. Can you elaborate a bit?
Sure. In the Ayurvedic framework, the condition is viewed as a type of Udara Roga, specifically Yakridaludara, involving imbalances in all three doshas. Kapha is seen as responsible for steatosis or fatty liver changes, while Vata contributes to fibrotic aspects, and Pitta brings on the inflammatory response, like jaundice and hemorrhagic tendencies.
Right. But don't you think categorizing liver disease solely based on these dosha imbalances might oversimplify the complex pathology of ALD?
That's a valid critique. While the dosha model may not map directly onto modern biomedical concepts, it provides a holistic therapeutic framework. It looks at detoxification, regeneration, and balancing metabolism, aspects that are supported by some modern studies on the hepatoprotective properties of these herbs.
Yeah, fair enough. I noticed that the case report emphasizes monitoring through repeated liver function tests. How critical was that in assessing the treatment's success?
It was pivotal. They conducted liver function tests every 15 days during the initial phase of treatment, and follow-ups continued for about 12 months. This rigorous monitoring showed a gradual reduction in bilirubin levels and transaminases, and ultrasound scans confirmed normalization of liver size and echo texture, demonstrating the efficacy of Ayush interventions.
Mm-hmm. It seems like a very comprehensive approach. Did they mention any limitations?
Yes, indeed. The authors clearly mention that this is just a single case study and caution that broader clinical trials with larger sample sizes are essential before drawing definitive conclusions. They recommend further studies to validate these findings across different liver diseases.
Right. What stands out here is the integration of classical formulations with modern diagnostic monitoring. It's a blend of tradition and contemporary practice.
Exactly. It's quite like assembling a puzzle where both ancient wisdom and modern science play their parts perfectly. Furthermore, the detailed timeline and clear documentation of interventions really lend credibility to the approach, even though we must be cautious not to generalize based on one case alone.
Yeah, I totally agree. I find it interesting how the regimen was methodically structured, starting with detoxification using bitters, then moving to supportive tablets. Can you share any insights on why bitter compounds are so crucial in Ayurveda, especially in liver detox?
Sure. Bitter tasting herbs, as used in formulations like Patola Katuro Hinyadi Kashaya, are considered highly effective in pacifying pitta and kapha. This helps reduce toxin accumulation in liver tissues. Additionally, some of these compounds, like those found in kalmeg, have been shown in modern studies to reduce oxidative stress and lipid peroxidation.
Mm-hmm. That ties in very well with current research on antioxidants and liver protective mechanisms. It seems the Ayurveda treatment strategy is multi-pronged.
Absolutely, it's a layered approach, combining mild laxatives, hepatoprotective agents, detoxifiers, and a strict dietary regime. The careful increment in treatment modalities over time mirrors the gradual healing of liver tissues, much like how you might delicately piece together a recovery puzzle.
Yeah. One last thought. Do you see potential for larger scale research translating these methods into broader clinical practice outside of Ayurveda?
I do. Although this report represents just one case, the structured approach and measurable improvements provide a strong incentive for more extensive controlled studies. It might not replace conventional treatment, but could serve as a complementary method, especially in regions where Ayurveda is deeply rooted in the culture.
Right. Fascinating insights. It's a clear example of how traditional medicine can inform and, in some cases, enhance modern therapeutic approaches when rigorously evaluated. Thanks for breaking it down so thoroughly.
Thank you. It's been a pleasure exploring these insights together. Until next time, keep questioning and learning.